Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is Utilizing Outside Experts on the IRB, What We Didn't Know, What We Now Know, and Where We Go From Here. It's presented by Dr. Kimberley Serpico from Harvard Chan School of Public Health. Dr. Serpico is the Associate Director of IRB Operations for the Harvard Longwood campus schools, including Harvard School of Public Health, Harvard Medical School, and Harvard School of Dental Medicine. Kim has worked in higher education institutions on their IRBs for over 15 years. She received her doctorate in education from Vanderbilt University. She completed a postdoc fellowship at the Harvard Medical School Center for Bioethics. Kim is also a certified IRB professional.
We have 4 learning objectives today on my talk about outside experts. We're going to review the regulatory provisions that allow IRBs to utilize outside experts. We'll discuss my project findings. We're going to think about any unmet needs or barriers or challenges related to using external consultants. And we'll also talk about how IRBs use outside experts to make decisions and how they impact the quality of IRB review. Our project summary has 3 phases. The focus of this presentation is to discuss phase 1 in depth, and then I'll give an update on phases 2 and 3 closer to the end of this talk. When we started this project, phase 1 of this project, we set out to discover what was known about using outside experts by IRBs. In our scoping review and our literature review, we quickly found that the body of literature was almost non-existent, if not completely non-existent. So we shifted the focus to accomplish 3 things. First, we still wanted to offer a cohesive view of all of the known regs, standards, and practices that IRBs can use when using outside experts. But we also wanted to identify the critical gaps in the literature and the unmet needs of IRBs. And then finally, we wanted to set forth an agenda for future empirical study to close these gaps and then also to provide support for the HRPP community. And so now we're going to move into a more in-depth discussion of phase 1. Phase 1 sought to serve initially as a literature review, as I mentioned, and an orientation to what we currently know about IRB utilization of outside experts. Our first paper, entitled Institutional Review Board Use of Outside Experts, What Do We Know?, was published in the Ethics and Human Research Journal in 2022. And this paper accomplished our shifted goals by offering that cohesive view about what was known about allowing the use of outside experts. And then we also talked about gaps and unmet needs, and then we set forth a full research agenda that we aim to conduct in phases 2 and 3. And so this phase 1 publication, the literature review, devotes a really good bit amount of coverage to the various regulatory provisions and permissions that permit IRBs to use outside experts. And so I summarized the 3 most standard of those pieces here. We all know and love the common rule, which permits expertise beyond or in addition to the IRB members that are already on the board. This is not something that IRBs can only call upon if they don't have it. Calling upon an outside expert is an option at all times. The FDA offers, pretty much word for word, the exact same allowance in the regulation, but they tack on a clarifier that the focus of the consultation should be on complex issues. They don't define this term, and I would argue that all FDA-regulated research is complex, but up for your interpretation. Finally, the third piece that we put forth in the paper is all of the various helpful guidance that OHRP has put out, which clarifies that experts can be used, but that also outside experts should be subject matter experts. They should not currently be IRB members. They should assist in the review. And OHRP guidance also encourages IRBs to have written procedures for how they go about using outside experts.
In closing, I also invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.